Good day, I'm Chimea Aura Alvero, and I will perform the female and male urinary catheterization return demonstration. Urinary catheterization is the insertion of a flexible tube or the catheter through the urethra into the bladder to empty it of a urine. Catheterization reduces the risk of infection and kidney damage by making sure that the bladder is empty either continuously or regular intervals. Urinary catheterization is usually used when people are having difficulty urinating, natural relief, or this could be used before or after surgery when necessary, and also catheterization is used to help in performing certain tests. Now, prior to the conduct of the procedure, verify physician order the catheter insertion. This is done to ensure that I have the right patient and the right procedure to be done. Next, I'm going to perform the hand washing to prevent the spread of microorganisms that causes disease and contamination. Good morning, I'm Chimea Aura Alvero, your student nurse for today. May I see your wristband, ma'am? Then please state your name and your birth date. Alright, so ma'am, we understand that you are having difficulty urinating, and so your doctor, Dr. C, has ordered for you to have a urinary catheter. So what I'm going to do is to insert the tube through your urethra and connect it into your bladder so that you can excrete your urine, okay? So later during the procedure, I'm going to expose your genital area and you might feel a little uncomfortable during the procedure, but afterwards you should feel relief. Will that be alright? Okay, so do you have any questions or clarifications, ma'am? So before we begin, I am going to close the door so that we can have your privacy. Then now I'm going to assess the bladder fullness and pain by palpation or by using bladder scanner. The rationale of this is that the palpation of a full bladder will cause an urge to void and pain. Then I'm going to position my patient to semi-upright and knee raised. Then apply gloves. For continuation, inspect perineal region for erythema, drainage, and odor. Also assess perineal anatomy because assessment of perineal area allows for determination of perineal condition and position of anatomical landmarks to assist with insertion. Remove gloves and perform hand hygiene. This prevents the transmission of microorganisms. So let's discard it, then use alcohol. catheter supplies. Here is the catheterization kit, the urinary bag, the Foley catheter, and then the last one is the prefilled syringe. So inside the catheterization kit, here is the forceps, the drape, the gloves. Also here is the betadine, then the lubricating jelly, and then the last one is the cotton with cleansing solution. And now I'm going to check the size and type of the catheter. And the smallest size of the catheter possible because the large catheter size increases the risk of urethral trauma. So I am going to use a 12-way Foley catheter with size of 12 French. And now I put the Foley catheter into the catheterization kit. So let me discard this. Now place the waterproof pad under the patient. This prevents soiling of bed linens. For the positioning of our patient, it depends on their gender. For female patient, on back with knees flexed and thighs relaxed so that hips rotate to expose perineal area. Alternatively, if patient cannot abduct leg at the hip, patient can be side-lying with upper leg flexed at knee and hip, supported by pillows. While in men patient, supine with legs extended and slightly apart. This is for our patient to be comfortable with perineum or penis exposed for ease and safety in completing procedure. Now place a blanket or sheet to cover patient and expose only required anatomical areas. These steps help the protection or to protect our patient's dignity and privacy. Then now apply clean gloves and wash perineal area with warm water and soap or perineal care according to agency policy because cleaning removes any secretions, urine and feces, and reduces risk of catheter-associated urinary tract infection. So for our female patient, I'm going to get a washcloth and then wet it and make a knit. Then I'm going to apply soap onto it. So using this rule of sevens, I am going to wipe first the labia minora, which is the inside. So I'm going to separate the labia and then wipe from the clitoris and down. Then I'm going to put the used knit washcloth into the hamper and use a new one. So after that, I'm going to wipe the labia majora with a new one knitted washcloth using the rule of sevens, and then get a new one and wipe the other side. After that, I'm going to clean the middle part using a new washcloth in downward manner. After that, I'm going to rinse it using same procedure and dry it. In male genital area, first start washing the urinary meatus using circular motion. Then wipe the shaft downward using another washcloth every sides of the penis. Then wash the scrotum by lifting it to also wipe it into posterior part. I am going to ensure adequate lighting as it helps with accuracy, speed of catheter insertion. Remove gloves and perform hand hygiene. This reduces the transmissions of microorganisms. Discard it, then perform hand washing. Now add supplies and cleansing solution to catheterization kit and according to agency policy. These steps ensure preparation and organizations for procedure. If using indwelling catheter and closed drainage system, attach urinary bag to the bed and ensure that the clamp is closed. The rationale of this is that urinary bag should be closed to prevent urine drainage leaving bed. Now apply sterile gloves using sterile techniques. This reduces the transmissions of microorganisms. Drape patient with drape found in catheterization kit either using sterile gloves or using ungloved hands and only touching the outer edges of the drape. Ensure that any sterile supplies touch only the middle of the sterile drape, and that sterile gloves do not touch non-sterile surface. Drape patient to exposed perineum or penis. The outer 2.5 centimeters is considered non-sterile on a sterile drape. Now lubricate the tip of the catheter using sterile lubricant included in tray or add lubricant using sterile technique. Lubrication minimizes urethral trauma, discomfort during procedure. And now let's check for the balloon inflation using a sterile syringe. This maintains sterility of the catheter. Place sterile tray with catheter between patient's legs. The rationale of this is that the sterile tray will collect urine once catheter tip is inserted into bladder. Clean perineal area as follows. Use sterile forceps and a new cotton swab with each cleansing stroke. In female patients, separate labia with fingers of non-dominant hand. Using sterile technique and dominant hand, clean labia and urethral meatus from clitoris to anus. Then discard it. And from outside labia to inner labia, folds and urethral meatus. Then discard it and the other side. Okay. And in male patient, gently grasp penis at shaft and hold it at right angle to the body throughout procedure with non-dominant hand. Using sterile technique and dominant hand, clean urethral meatus in circular motion, working outward from meatus. This maintains sterility of catheter. Now pick up catheter with sterile dominant hand, 7.5 to 10 centimeters below the tip of the catheter. Holding catheter closer to the tip will help to control and manipulate catheter during insertion. Insert catheter as follows. In female patient, ask the patient to bear down gently to help expose urethral meatus. Advance catheter 5 to 7.5 centimeters until urine flows from catheter. Then advance an additional 5 centimeters. In male patient, hold penis perpendicular to body and pull up slightly on shaft. Ask patient to bear down gently and slowly insert catheter through urethral meatus. Advance catheter 17 to 22.5 centimeters or until urine flows from catheter. This process helps visualize urethral meatus and relax external urinary sphincter. Note, if urine does not appear in female patient, the catheter may be in the patient's vagina. You may leave catheter in vagina as a landmark and insert another sterile catheter. Note, if catheter does not advance in male patient, do not use force. Ask patient to take deep breaths and try again. If catheter still does not advance, stop procedure and inform physician. Patient may have an enlarged prostate or urethral obstruction. Place catheter in sterile tray and collect urine specimen if required because urine specimen may be required for analysis. Collect as a agency policy. Slowly inflate balloon for indwelling catheters according to catheter size, using prefilled syringe. The size of balloon is marked on the catheter port. Note, if patient experiences pain on balloon inflation, deflate balloon, allow urine to drain, advance catheter slightly and reinflate balloon. After balloon is inflated, pull gently the catheter until resistance is felt and then advance the catheter again. Moving catheter back into bladder will avoid placing pressure on bladder neck. Connect urinary bag to catheter using sterile technique. Keep urinary bag below the patient's bladder. Secure catheter to patient's leg using securement device to tubbing just above catheter bifurcation. In female patients, secure catheter in inner thigh, allowing enough slack to prevent tension. In male patients, secure catheter to upper thigh, allowing enough slack to prevent tension. Ensure foreskin is not retracted. The rationale of this is that securing catheter reduces risk of CAUTI, urethral erosion, and accidental catheter removal. For male patient, leaving the foreskin retracted can cause pain and edema. Dispose of supplies following agency policy as it reduces the transmissions of microorganisms. Remove gloves and perform hand hygiene. This reduces the transmissions of microorganisms. So discard this. For our last step, document procedure according to agency policy, including patient tolerance of procedure, any unexpected outcomes, and urine output. Rationale is that timely and accurate documentation promotes patient safety. Once again, I'm Chimea Aura Alvero, your student nurse for today. Thank you.